It's a big business deal that's raising lots of questions about patient privacy. Amazon plans to buy the primary care group One Medical in a nearly $4 billion deal, adding to the growing list of the tech giant's acquisitions and efforts to expand its footing in the healthcare industry. One Medical is a membership-based primary care practice with nearly 200 locations across the country. And privacy advocates are already voicing concerns about Amazon controlling data about someone's online purchases and streaming content, as well as their healthcare records. For more on this, Erin Brodwin, health tech reporter at Axios, is with us. Erin, it's great to have you here. And as you well know, this is only the latest of Amazon's healthcare ventures. It acquired the online pharmacy company PillPack back in 2018. It launched its own Amazon pharmacy in 2020. What does acquiring One Medical represent for Amazon?
I mean, as you said, Amazon was already a powerful force in the healthcare space. This deal turbocharges all of their existing efforts in the space. It's really about three things, the way I think about it. It's about scale, it's about hybrid primary care, and it's about entering the Medicare Advantage market.
So you already have lots of One Medical customers who are saying they're going to cancel the memberships because of this Amazon deal. They want no parts of this because of privacy concerns. What, if any, impact might that have on this acquisition, on this deal?
Yeah, so I think that's a really important concern. Amazon does have a spotty track record when it comes to consumer privacy. I do want to point out, though, that because it is acquiring One Medical, which is a medical provider, One Medical has to abide by HIPAA, the Health Information and Protection Act. So it has a lot of protected health information, but that shouldn't be, violated for any reason that I know of. In terms of Amazon's track record, though, there are instances in which the company has given broad swaths of its global workforce latitude to tap into consumer data. I mean, 44% of US residents use Prime. That is a crazy amount, especially considering that the largest healthcare system in America, HCA, only has access to approximately 1% of US residents. Amazon knows what you're buying, what pills you take, and it can guide your decisions to buy and when, and will probably use those in terms of healthcare.
Well, let's talk more about that and sort of take a big picture look at this. Is there a trade-off between people having both convenience and privacy?
Yeah, I think there definitely is a trade-off. I think it's very easy to sit here and say, I don't want this. I don't want Amazon in my life, or I don't want Google in my life, or I don't want Apple in my life. The fact of the matter is we use these companies for so much and they are so ever present in our lives that saying, okay, because of this decision, I'm no longer going to have this tech company present in my life. I'm just going to cut them out. I just don't think that's particularly doable. I remember a lot of my friends, for example, when Google acquired Fitbit, they said they were going to, abandon their Fitbits. And to this day, I know 0 people who have done so.
That's marketing 101, right? There's always this disconnect between what people say they're going to do and what they actually will do. This acquisition is part of a larger trend of big tech companies trying to expand their footprint into healthcare. What accounts for that? And what's the expected impact?
I mean, I still remember it was just a couple years ago when Tim Cook at Apple said Apple's biggest impact on society was going to be in healthcare. And I think that's kind of what set all these big tech companies on this big race to get into this space. I mean, healthcare is a $4 trillion industry. It is huge. Google is here, Apple is here, Amazon is here, and so many other big tech companies. I would say prior to this acquisition, there was a really tight race between all these companies as to who was going to dominate in healthcare. The deal hasn't closed yet, so I'm not trying to get ahead of myself here. But post-acquisition, I think this puts Amazon in the clear lead. It's definitely going to set all these other companies' efforts to warp speed as well. But again, I'd say Amazon does have a little bit of a lead.
Amazon and One Medical say this deal will make things more convenient for those using healthcare services. Amazon also says this acquisition will help make healthcare more accessible to people who haven't had access to it. So will Amazon's expansion here make healthcare more accessible, more broadly available?
I'd love to say the answer is yes, but unfortunately, I do not have any current evidence to support that theory. And I say that only because Amazon's efforts in healthcare so far have been largely directed at the worried well. And so have One Medical's. They largely serve people who are fairly affluent, fairly wealthy, and want what they call concierge medical care. I will say Amazon had one effort that was targeted at the working class. It had a partnership, still has a partnership with a company called Crossover Healthcare, and so they have clinics set up with them near Amazon warehouses. It remains to be seen how this deal will impact those. I definitely will have my eyes peeled for that. But I don't see this deal as about equity or accessibility, to be honest.
All right, Erin Broadwin covers health tech issues for Axios. It's great to speak with you. Thanks for your time.
Thanks so much for having me.